WEBCAST is now starting. All attendees are in listen-only mode.
Hi, good afternoon. Today is Friday, April 3rd. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the third Friday of our series of DDA updates. Presenting today is Bernie Simons, Deputy Secretary for DDA, and we'll also be hearing from Patricia Sastoki in Q&A. She is the Director of Programs, and we'll also be hearing from Rhonda Workman, Director of Federal Programs for DDA, about Appendix K. And finally, we have Tanya Ferguson. She's the Chief of Staff on Personal Protective Equipment. So before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options for listening, by computer and by phone. And if you have trouble hearing, you can try switching and clicking on the appropriate button on the webinar panel. So there's one handout for the webinar, and you can find it in the handout section. And I can also email them to you if you need a copy. We're recording the webinar today, and it will be posted on the DDA website. Questions can be typed in the question box in the webinar panel. However, we'll get to those at the end of the presentation. So now I would like to introduce Deputy Secretary Simons. Good afternoon.
Thank you and good afternoon, and thank all the people who are basically here in our Friday updates. This is the third one, as Donna just said, and I think it's important that we stay with open communication that goes both ways. That obviously we're concerned with your feedback and concerns that you have, either as a family member or people who are self-directing or agencies or micro boards, case management entities, etc. And so obviously we know we're all in this together. We know that this is very serious. We see the numbers that the governor talks about. We see that the concerns that the governor has raised in either his press conferences or where there is an article in the newspaper. So again, we're going to do the DDA regional update, resource sharing, Appendix K, and questions. So again, I want to thank everybody who's here, and obviously we're all concerned about everybody's health and safety and well-being. We want to make sure that you are signed up, hopefully, for our DDA email list, so that when we do updates, such as the one we sent out yesterday on PPE, that you will get those either provider alerts, as we call them, or just an overall update. So please go into our website, click on join our mailing list, so that you don't miss anything that we have formulated in conjunction with stakeholders. So if you look at the next slide, you'll see SMRO and who our contact people are, etc. And what I'd like to do is give you a little update of where we are. So the South region has had 3 confirmed positive tests, 12 negative, 13 pending, and has had our first confirmed death from COVID-19. The East region has 0 confirmed positive. 5 tests were done that were negative and 1 pending. The Central region has 1 confirmed positive. 10 test results were negative, 10 are pending. But what we've heard back from a lot of the providers is that there is about 80 individuals, nurses and staff that have been exposed. 17 of those individuals have tested positive. And then in the West region, we have had 1 confirmed positive, 8 tests were negative, and there is 1 pending that basically they're waiting to see on. So that's kind of where we are with what we know, with indications. I think that I want to thank the provider community for continuing to reach out to the regions to keep us updated of what your current situation is. Remember, we all need to be safe. We need to keep social distance. We need to wash our hands, use sanitizer, follow the guidelines from the Center for Disease Control, our department, Maryland Department of Health, and DDA guidelines for quarantine. Stay home as much as you can. Obviously, you know, people still need to go out, as the governor talks about, and do grocery shopping, but you know, let's not go out just for anything else outside of necessities. If you don't feel good and you think you get the onset, please contact your doctor. And please make sure that we are communicating with our local health departments. Many of you have seen the governor do his press conference. With him is Deputy Secretary Fran Phillips, who basically is our Deputy Secretary for Public Health, who works very closely and has oversight of the local health department. So please, we need that surveillance. And because we are DDA and part of the overall Department of Health, and where this is a public health issue, we appreciate all the hard work that Deputy Secretary Fran Phillips does. So again, let's make sure that we are staying safe, that we, if we want to, within our agency, start taking temperatures. I mean, you see that in multiple places where people will go in and they'll be screened, so to see if they have a temp, etc. I want to point out that we've changed our website a little bit, and so you'll see on this slide that there is an information slide. So that would be click 1. Click 2 would be on how to get some information and where we are. So we've tried to simplify this so it's as user-friendly, and make sure that people have the opportunity to get appropriate information that is from, again, the department that Secretary Neal has approved, that we have information obviously from the CDC and from public health. And so you'll see that this is information for providers in the next slide. So then you'll get to this, and then you should have just about anything that there is to know about COVID-19 as far as resources, etc. And so, again, I think we've tried to make this as user-friendly as we can. It seems to be. I would welcome your feedback, and if we could just, you know, it'd be good to get some feedback, like, you know, is there something missing? Is there something else that you would need, etc., that we can then explore, again, through our department, who has the lead as a state agency. So we've got that dedicated email to submit questions, which goes back to the toolkit, which gets to, you know, what is currently on our web, what is missing, what do you think we need to do collectively in order to do this. We will post those back on the website, or make changes to our website as we have to, and we will update our FAQs. And obviously there's the toolkit that we developed, and we've gotten some positive feedback on that. I'm going to ask Tanya to do the next slide, but before I go there, I know that there was a lot of concern back a few weeks ago about the fourth quarter payment, and it's my understanding from the feedback I received that everybody should have their fourth quarter payment in their accounts today. So Tanya, if you'd pick up from here.
Yeah, so on the personal protective equipment request, please make sure that you contact your local emergency operating system operations center for vetting and processing requests for your organization. We shared yesterday communication regarding PPE. We know that some of the organizations actually did fill out the request form, and unfortunately you got a call back stating that you were not the highest priority based on you providing services in a home and not in medical facilities. The DDA wants you to know that we are absolutely advocating for you. I have directly sent an email to Carol Beatty, Secretary of Maryland Department of Disabilities, to ensure that DDA's providers are being heard on PPE. If you have any questions or concerns regarding needing PPE or you cannot get in contact with your local emergency agency, please do not hesitate to reach out to me.
Thank you, Tanya.
You're welcome.
So obviously there's a stay-at-home order that includes everyone, including people in self-directed services. We have a link here to the interpretive guidelines, and obviously a link to residential homes and essential staff travel guidance. We had a lot of questions about this. Were direct support professionals considered essential? The answer was yes. We've seen that in the governor's executive orders. There were some questions from some of the providers about people traveling either from their own home to a group home or an apartment setting, wherever the residential services were being provided. We have some guidance in there. And so, again, everybody is really essential. We know that basically the residential people are doing a lot of work. We also know that we have a lot of providers who provide day services and not residential who are collaborating with the residential providers, and I want to applaud everybody for that, since this is basically such a significant time for everybody to meet the needs and take a look at our workforce. So, Rhonda, do you want to start taking over about Appendix K? And just so that everybody knows, Appendix K, it was issued and discussed on multiple calls with the leadership of the Center for Medicare and Medicaid Services, specifically the #2 person, who is Calder Lynch, and many of his senior staff to address the waivers and what that looks like. And so we obviously have participated as a state on those calls. And Appendix A basically gives the opportunity for the state to make changes with our current approved appendix that was submitted and approved by CMS, that says this is the way we're going to do business, this is the way we're going to do billings, this is the rules and regulations, and it gives us an opportunity to suspend many of those regulations. Rhonda?
Yeah, thank you, Bernie. So some updates about Appendix K, and then we'll just go over a few of the slides that was in our presentation last week. But the DDA has been working with some stakeholders and got input related to the development of Appendix K. And we submitted the Appendix K, which includes all of the DDA waiver programs, the family supports, community supports, and community pathways. And we submitted that to Medicaid for the review. The Appendix K right now is being reviewed by the Maryland Department of Budget and Management because the request includes a fiscal impact to the state for the request of the exceptions we're asking. Once approved from the Department of Budget and Management, or once they make their decision, then the Maryland Department of Health Medicaid Director, Dennis Schrader, would review and submit that upon his approval. Once CMS approves that, we will obviously let everybody know. In addition, this week we had an opportunity to discuss and share some of the information with the DD Coalition yesterday, or recently. So we appreciate that opportunity to share and get some feedback from them. So just some updates or reminders of what the Appendix K provides opportunities for us to do. It allows us to temporarily waive or make exceptions to things like our service requirements, requesting to exceed service limitations or requirements, We're requesting to increase some payment rates for specific services when someone has been confirmed to have the virus. We are also proposing to include specific retainer payments to address the emergency related to issues of not being able to provide services or closures. It also allows us to modify provider qualifications, staff training, and onboarding requirements so that we can make some exceptions to that to bring on new staff quickly. We also are requesting to modify our licensure or other requirements for settings where waiver services can be furnished to include hotels, churches, and other community sites. We're requesting the ability to accept electronic signatures for plans and agreements. Also having electronic method for service delivery, such as telephonic or remote services. I'm also looking to have the ability to modify some of our incident reporting requirements, as we know some of our staffing levels may be adjusted in this time of emergency. And then just some examples of those opportunities that we were just talking about. We're requesting specifically for our community living group home services to add an additional retainer payment of up to 30 days. That would be a total of potentially 60 days when you add that to our current residential retainer fee. We're also looking to authorize additional shared staff supports in our residential programs. When there are up to 3 people, we're looking at adding an additional 8 hours, up to 5 people, 16 hours, and up to 9 people, 24 hours. And these hours would be authorized to support people who obviously are not able to attend their meaningful day services and then therefore are being supported in the home all day. In addition, for our meaningful day services, such as employment services, supported employment, community development services and such, we're requesting the ability to have services be able to be provided in a variety of settings instead of the community. We've included examples such as providing these services in the person's home, a family or friend's home, also in our licensed residential settings or other community settings based on where the person is best being supported. We are also looking to waive the requirement to have individualized schedules being updated for the participant in terms of their meaningful day activities. So that would be suspended during this state of emergency. And also requesting the ability to exceed our current limitations so that services can be provided any day of the week to include Saturday and Sunday. Services could exceed 8 hours a day and also could exceed the 40-hour limit requirement that we currently have. In addition, we're looking that services could be provided in a variety of non-community-based settings, such as the homes we just mentioned. We're also looking to extend the time frame for completion of one of our services referred to as employment discovery and customization. Currently, people are in that process. We wanted to provide flexibility to extend that. And then in addition, we wanted to be able to provide an opportunity for people who are self-directing services to be able to have the employer authority over the follow-along employment supports. And then a couple more related to Meaningful Day. Currently, we have a requirement for our traditional services for Meaningful Day that they have to be provided a minimum of 6 hours a day. And so we're requesting the ability to temporarily suspend that so that the provider can provide less than 6 hours of services. And then finally, we're looking to also have a retainer payment for our Meaningful Day services up to 30 days unless otherwise authorized by DDA. In terms of some of our support services, for behavioral support services, these services can be provided at the same time as the direct provision of respite care services. We're also having the opportunity for behavioral consultation and brief support implementation services to be provided if they're not already in the person-centered plan without prior authorization from the DDA. And also want to have the opportunity for a providers organization's director or a MANT trainer who is otherwise not licensed to provide behavioral support services and create behavior plans to permit them to be able to develop temporary emergency behavioral safety plans to support people currently based on this crisis. In terms of our self-directed service for individual and family-directed goods and services, we want to increase the current limit for our staff recruitment and advertisement dedicated funding, which is at $500 currently, up and add another $500. So that would be additional $500 that people can use to try to recruit staff during this time. Then we're also looking to provide more flexibility with our self-directed services in terms of budget modification requirements. And so we want to have the ability to authorize our fiscal management service providers the authority to make those budget modifications based on the person-centered person's request and utilizing a very simplified form. That includes making changes from current services to increasing one service and decreasing another, and also having the ability to move money into a brand new service without getting authorization from the DDA. In addition, we're proposing to provide and authorize up to $2,000 above the current authorized self-directed budget for people if they have an increased need related to services such as our personal supports or CDS. If they have a need to increase their support broker hours for additional support with hiring and recruiting staff during this time, that additional $500 for staff recruitment I just mentioned, and also to be able to use these funds to support personal protective equipment and supply purchases. For our nursing services, we want to be very flexible. So if anybody is in need of nursing services that's not currently authorized, we are waiving the authorization requirement from DDA so they can be provided. That includes if people need additional delegation services. For our personal support service, we want to waive some of our current requirements and have the ability to pay our legal guardians and relatives more than 40 hours per week. We also want to have the ability for personal support to be able to be exceeded beyond the 82 hours without prior authorization from DDA if it's currently within the authorized budget. And also overall for people to be able to exceed their current authorization, because some people may have less than the 82 hours, as long as they stay within their overall authorized budget. And then a couple additional ones, we're also looking at having the ability to have a retainer payment for personal supports up to 120 hours when services are not available due to closures or other challenges. For respite, looking to have approval to authorize up to an additional 360 hours for COVID-19 related emergency care services. And then for our support broker services, which are currently limited to 4 hours a month, being able to exceed that limitation up to 20 hours per month unless they've already been authorized. And so some of the next steps for our Appendix K, we're currently working on detailed guidance related to implementation and operationalizing some of the things that we just shared. In addition, we're creating some really brief, reader-friendly at-a-glance sheets to help inform and operation our Appendix K for all of our stakeholders. And we'll continue to provide updates on the status as the Appendix K moves forward.
Thank you, Rhonda. So, I think it's important, as Rhonda just said, we are. I was concerned that we needed operational guidance, because it's one thing to see some of these numbers on a slide that says, and go back to the previous slide, it says respite care services up to an additional 360 hours. And what does that mean? And what does it look like? And what type of documentation are we going to need? I'm going to make an assumption that at some point in time, the Center for Medicare and Medicaid Services, with giving us additional retainer days, et cetera, are going to say, so how much did you use? How much did you bill Center for Medicare and Medicaid Services? which obviously relates back to the earlier comment about, Department of Budget and Management, because there obviously will be a share with the state. But I think we need to make sure that we don't just say, here's Appendix K and here's the hours, et cetera, that people can be approved for, and not have additional guidance for what the expectation is, recognizing that it's got to be user-friendly, not onerous. I mean, back a few weeks ago, we suspended all the modified service funding plans. We didn't need them. We need to do business differently. We can't be asking people when they are trying to get staff, keep staff, and meet the needs of individuals, keep everybody healthy and safe, and get caught up in a lot of paperwork. So our commitment is we'll continue to share information and resources. And again, as I said earlier, I would definitely appreciate any feedback that we could get on the website that might help with additional guidance that currently you think is not there. We will continue to collaborate and advocate for everyone, family, staff, agencies, people self-directing, micro boards, etc. And we'll continue to keep you updated as we learn more about our Appendix K and when Medicaid and Dennis Schrader will be for Medicaid will be submitting that CMS. With that ends basically our formal presentation from DDA. I hope this was helpful. Things don't change sometimes that much week to week. So, I thought that, you've seen some slides here, maybe a little bit reordered, but talking about Appendix K, because this is extremely important to all of the people within DDA. So with that, we'll take questions.
Okay, Bernie, I'm going to read them, and then we'll just go through them as they come in.
Okay.
Okay, working on them. So currently, group home providers have staffing and are providing in-house programs 24/7 for residential staff. How would they get paid for the services rendered in the homes?
So we actually added that into Appendix K, recognizing that some residential providers do not do day services, and so but would need their residential staff to provide that. So that's built into Appendix K to pay our group home providers.
So last week, you said that Appendix K was submitted. This last deck says that it wasn't. This is forcing agencies to gamble either way, folks, and hope that we can get reimbursed.
So I think, for clarification, I think last week I said that the DDA was submitting it to Medicaid. If I didn't say Medicaid, I apologize. But obviously it goes through Medicaid. Then, because there's a fiscal note to this, it's got to go to Budget and Management, and then after there, it goes from Medicaid to the Center for Medicare and Medicaid Services. I've gotten a lot of emails this week from providers. Totally understand that the board of directors of a lot of these agencies are concerned with keeping staff now and then paying them and then having a liability down the road. So we are working as quickly as we can to get this submitted and get the approvals from CMS.
So this was about furloughing staff or laying off people, and how would retainer payments for day programs be impacted if organizations put staff on furlough?
Well, I think the purpose of the retainer was to have the money go to the agencies so that the agency would have some financial stability. I mean, if we're going to start laying people off, and I totally understand that the pressures of the provider community and what some of the board of directors are feeling, but we're taking a little risk there with you don't have staff and they go and do something else or decide not to return when this pandemic is over, then we will not necessarily have a stable workforce. And it'll be very, very difficult to start recruiting and to bringing new people on. I don't know what the provider community feels about that. I know I've had conversations about with the DD Coalition about what does some of this look like. Again, we've had a lot of conversations about financial stability with the retainer days to hopefully keep the providers whole.
Bernie, are the numbers that you share per region about positive tests and the one death, et cetera, are individuals or staff or both?
The majority are individuals who are in supports and services. We basically have asked the regions, and we did a call a few weeks ago with each individual regional director and some of their staff and as many of the providers, and I think that the attendance needs to be applauded, that the providers who attended. And so we did not statewide, so we did one call with all of the providers in East, in West, in Central, and in South to say, what do you look like? What problems is your agency experiencing? If you don't want to talk about this in front of your fellow providers, then please submit it to the regions. And then we are doing surveillance and asking the providers when they are having issues to submit it in. And we actually have a document where we are tracking this.
Will DDA pay day providers for virtual services to individuals while in their residential home?
Well, I would say yes, but I think that needs to be coordinated between the residential provider and the day provider. That's something that I can say, yes, we will pay, but again, I think it needs to be worked out. If the residential provider says, I'm going to do 24/7, then the day provider needs to have some discussion with the residential provider in order to be able to provide those services virtually.
First and foremost, thank you, DDA, for taking this Appendix K actions. Is the rate increase specifically to cover shift differential for people working with suspected or confirmed cases of COVID-19? And if so, do you know, is there a percentage increase?
We did add in if someone tested positive for COVID-19, that we would pay an enhanced rate to that agency to pay their staff an enhanced rate, so that people would come to work. I don't think people are going to come to work for the same amount of pay if they're working with somebody who's been exposed and tested positive. I would have to ask either Rhonda or Valerie Roddy's on the phone. I don't recall the percentage that we put in Appendix K.
Yeah, this is Rhonda. Bernie, we put in a 50% for the rate would be increased.
Thank you.
The next one is, what can be done now while you are waiting for the Appendix K approval? People are needed to make changes now, not to mention in the last 3 weeks.
Well, they're really, outside of having discussions with the providers about what their challenges are and trying to have some of the providers who have provide day services and people are staying back in the residential, and recognize we get about 6,000 people in residential and we have about another 10 or 11,000 who just get some type of meaningful day. That I've heard from some of the meaningful day providers that they have furloughed or taken other actions so that they don't have staff. So I think we need to go back and start taking a look at what does this look like. I don't think that we have the resources without Appendix K to assist us with moving forward. Again, I'm not so sure when we talk to the providers and they say we're furloughing, 30 staff or 40 staff or 5 staff. Obviously, if that's the case and they're not providing services, they shouldn't be doing billings. So we need to evaluate that. I mean, this is early on for us at DDA also. Nobody's ever experienced anything like this.
Thank you, Bernie. This one is more specifically to slide 18 on the behavior support services. Does the second bullet mean that consultation and behavior supports implementation can be provided for people who are not funded already for BSS and without the requirement of the assessment and plan milestones? Rhonda, can you answer that one, please?
Yes. Yes, based on what we have written right now, and we'll provide additional guidance, we're proposing that brief support implementation services and behavioral consultation can be provided without prior authorization from the DDA. We want to make sure that we're getting supports in the home now. So yes, that would be the option and opportunities there.
Okay, this one is a long one, but I'm going to summarize it. This is more about health and safety, and what should providers be doing to create quarantine sites, etc. Since there's lack of PPEs or not knowing how to reuse the equipment or what kind of guidance on how to use the equipment. Can DDA advocate heavily on this guidance and in writing from DOH?
From DOH?
Department of Health.
Oh, MDH, got it. So, yeah, we will continue to advocate that for all PPE and equipment, et cetera. And our point person is our chief of staff at DDA, Tanya Ferguson. Again, she's the liaison. She does a lot of work with Secretary Beatty in the Department of Disabilities. She does a lot of work with the other administrations within the department, whether it be public health or behavioral health or even Medicaid. And so, yeah, we will continue to do and advocate and provide as much guidance. Again, sometimes it's coming from the state perspective, and the provider community will say, well, that really doesn't meet my needs. So again, if we are issuing something that doesn't appear to be clear, it's one of the reasons why I meet with the DD Coalition. I've set up weekly meetings with them so that we can vet things and say, is this clear to you? Do you understand it? Do we think the provider community, what did DDA miss, et cetera, so that we are as respectful of each other's time in these difficult times, so that we are not having people read something and say, well, I just read it and I wasted, 10 minutes and I'm not sure what guidance that gave me. So, I want to be sensitive to everybody's time, to everybody's needs, and again, to make sure that we're giving appropriate guidance. Guidance may not be coming from DDA. It might be coming from the Center for Disease Control. It might be coming from Public Health Administration within our department. It might be coming from other state agencies who are affected and maybe interacting with our folks.
So Bernie, thank you. While you were saying all that, I was able to do a whole review of the Q&As. There's multiple ones on can DDA provide guidance on what providers can do now on making decisions to operate their businesses until Appendix K gets done, and what kind of billing procedures and process we put in place. And that this touched a little bit about what you just said about DDA providing guidance, but they wanted to know, well, how should they be moving forward? And there's multiple like that.
Well, again, I mean, this is new for us, and I don't mean to be ducking the question, but, you know, I think that the providers basically have to figure out what are they doing. We know some providers had not even, we had no conversations when some of the providers were furloughing their staff or doing some type of layoff. I think each agency needs to take a look at what do they have for their solvency. You know, again, we at DDA will continue to move for Appendix K. That really is the relief for our DD community in order to have additional funding. And so, again, one of the issues that I think you said, Patricia, was, you know, how do we move forward with billings? I mean, that's going to be what we're going to put in our operational guidance. And so, you know, where the payment just went out today, and hopefully everybody should have it in their account, you at least have another 2 months of payment right now. My thought is not to hit the concern down the road, and, you know, I was going to be delivering services, or I was paying my staff and they weren't delivered. And you know, it's a fine line to walk with the retainer days. You know, we are making a good assumption that we're going to be approved for retainer days from looking at the CMS website and seeing what other states have been already approved for retainer days. So, but you know, that's a couple of quarters down the road with where we start looking at billings. And so also knowing that, you know, we tried to relax the staffing, which, you know, if you needed, you know, if you had 6 people in a home and needed 2 staff, but you don't have it, and you can get meet the needs of the individuals with 1 staff, you know, that has ripple implications. Obviously, we relax so that, you know, the requirements on staffing are relaxed. Also that the requirements that you will be violating health and safety, and therefore triggering some type of OHCQ investigation, et cetera. I mean, we've relaxed all of those things.
So Bernie, I would just add that maybe some of the providers or listeners can also go to the presentation from last Friday, where it also talks about federal resources that we share and opportunities that some of the agencies and providers can take advantage of in reference to what they can be doing to make some financial decisions or some support. There's another one here for clarification. Can you please clarify what is meant to suspend modify service funding plans? Is this for all services or just needing services during this crisis?
This is during this crisis that we suspended the modified service funding plan. We're going back and actually looking at that process. You know, we know before we suspended the long-term supports and services that the authorizations were going in through the person-centered plan. If there was a need or a change, there'd be a modification to that person-centered plan. So that would be the authorization. So we basically need to think about, even with the current system for the modified service funding plan, that I think we're a little too paper-driven. At some point when we get into the LTS system, and even before then, obviously we need to go back. I've had multiple conversations with the regions about this. How are we doing it? How can we streamline it? How do we do authorizations? Because obviously at some point there'll be an end to this pandemic, and you know, we need to move forward. But again, we need to maybe take an opportunity as lessons learned during this time of how do we do business differently? How do we streamline some of the processes that may be a little too bureaucratic?
Okay, and then there's about 15-20 questions in reference to what is our projection of getting Appendix K approved and submitted?
Well, I'm hoping that we know by the end of today and that it will be submitted, if not today, by Monday morning. We'd have to reach out to Medicaid, see what their timelines look like. I know that the feds, Center for Medicare and Medicaid Services, have been turning these around because they actually recognize that, that this is a crisis, that the states need help, and that they've been very responsive. In fact, I have a call at 3 o'clock with CMS with the states to basically get some updates.
Then there's several questions about, can direct care staff offer virtual supports like FaceTime, drop-in phone calls, or remote supports to people who they cannot see, who live in their own home or with an elderly caregiver?
Yeah, I don't see why not. We need to start thinking much differently. I mean, if you look at some of the assistive technology systems that are out there, you will see that some of them do remote. And it's not, and what the remote is that the individual lives in their own home or their own apartment, and the direct care staff is on the other end of the iPad, and they're having a discussion back and forth about what next steps to do to make supper. So I don't think you need to be physically present all of the time.
Okay. I'm just going through because some of them are about K. Some folks want to know, where's Appendix K? We have not posted it on the DDA website yet until it goes into CMS and gets approved. So we have not posted it. I know some of you are looking for it and you're asking where it is on the website. So we do not have it posted. We do have a more detailed presentation that our Deputy Secretary shared last Friday. And so as we get more information, we'll update it and put it into our website. Most of them are about retainer payments and retainer days. Bernie, there's several on self-directed services about recommendations on the website. So I'll shoot those to you, Bernie.
All right.
I'm just going through them because they're very similar, all about Appendix K, the time frame. This one is there's 4 or 5 like this, Bernie, about individuals who live in group homes, and they've been living in group homes, residential homes for several years, but for the past few weeks when they started, they have gone home to be with their family. Will the provider receive income and funding? And also too, would the provider be allowed to give them some of their personal supports funding, money or for expenses? So the main question is, if they go home with their family, will the provider still be able to get paid for that person?
Well, they would under the retainer days.
Okay, and I think they're all repetitious, so I'm just going through it. Can you provide additional clarification regarding the requirements that personal supports increase or retainer hours within authorized limits? Are you referring to the annual budget authorization? Rhonda, can you respond on that one?
Yes. So yes, we're talking about the annual authorized budget. In addition, we are looking at if we can have the funding allocated to be able to also allocate additional personal support hours above the current budget. But at this point, we want to provide the flexibility for people who currently have an authorized budget to be able to use their whole budget in a different way, and even putting more money towards the personal support.
We already know that we will exceed the 30 days of closure. So will there be an opportunity for additional retainer days for meaningful day services?
So
Yes.
from my, I
Go
know
ahead.
we're I was just going to say, I know we're looking in our K, we're asking for that flexibility and the ability to go above that. And I think some of that's going to be based on the funding that's allocated or available to DDA.
Will providers still be reimbursed for in lieu of day or services if they receive disaster loans or funds from CARES Act or from any of the federal resources?
I think that's a great question, and something that we could add to include in our guidance. We'll be coordinating with Valerie and her fiscal staff related to that and legal advice.
Okay. This one is about DSPs. We have DSPs out sick and on vacation now without formal approval of the retainer payments. So we must furlough since we don't have work available for many of them. So Bernie,
and I guess, you know what,
go ahead.
I'm sorry, Patricia, I was just going to add that if providers don't have work available for some of their staff, then I would ask you to refer back to what Bernie said about other providers being creative, partnering with each other to offer their staff to provide services. So you may not have work for your staff to do, maybe your meaningful day provider, but we know that residential services are in desperate need and looking for additional help. So just encourage you to partner with other agencies so that, again, we don't lose that workforce by laying them off and them finding other jobs.
Okay. So some of the questions that we have on here, we're going to flip over to the DDA frequently asked questions. Some of it is clarification. There's a lot of questions between Appendix K approval, what happens if the CARES Act agencies get funded, and is there going to be a forgiveness for payroll for folks? So there's a lot of things that we are visiting and looking at how we would address that independent on the requirements and guidance, not only from our local, but our national resources. This question Bernie talked about last week, but it's about, are the provisions on Appendix K retroactive to the beginning? Bernie?
Yeah, they are. It's from the date when the crisis was enacted, which was back, I believe, when the governor did this in March. And obviously different states, I think the governor declared the emergency on March 16th, if my memory serves me correctly. I think other states that might have been a little bit early, some of them may have been later. And I think that the feds actually predated that to January. So any state that comes in from January 1st onward should be receiving payment. Again, it's retro. It doesn't mean like they approved Appendix K next Wednesday, and that's the date that the payment starts. It goes back to the first day of the crisis.
And just to clarify, Bernie, in Appendix K, we have requested it to be effective March 13th, and it would be good for a whole year.
All right, Bernie, I'm going through it all again, back to Appendix K, payment. Well, here's one. Can DDA and OHCQ approve apartment sites for living pending their location, being licensed by OHCQ for new admissions, or we just have to wait until COVID-19 outbreak is over to take new individuals looking for residential placements? So I've been talking to OHCQ, particularly Tracy DeShields, and who has said that if providers are looking at creating specific homes for for quarantine or using homes that haven't been licensed and looked at, that they want you to go ahead and email her directly, and they will expedite a virtual approval or on site, and they will not go on site. Everything will be done electronically so they can expedite the process. So they are working with us. We've been talking to them on a regular basis about how they're to support our providers when they have to either create a whole new site or do a quarantine location, or combine two houses to make one available, or to identify a whole new location and have it approved so you can provide the services. Is there an estimated time frame for how long LTSS will be delayed?
No, there hasn't. You know, when the secretary convened a group of stakeholders, and it was to discuss LTSS, and then you know, when this pandemic hit, and obviously when the governor said that the Maryland Department of Health is the lead agency, and knowing that the secretary is involved in all kinds of issues surrounding this pandemic, he authorized that we would, and I brought this up, I think maybe on our first webinar, that we would be delaying LTSS. There is no definite date when it will be even having discussion about where we are with it, with development and or whatever, since everybody is basically concerned, as we all are, with day to day.
So Bernie, this is going to be my last question to read out loud. What about modified service funding plans that were already submitted to DDA prior to COVID-19? Are you not reviewing any modified service funding plans, or are you not accepting any new ones?
Well, we
So,
suspended.
go ahead.
Go ahead. No,
So
we suspended the process.
Go ahead, Bernie, go ahead.
No, we suspended the process of the modified service funding plans. We need to get, you know, a little bit better. You know, if they come in, they don't have to come in paper. And so we should be issuing probably more guidance, because it seems like that this question keeps coming up.
Yeah, so our regions are continuing to work. If you submitted a plan already, they are reviewing it. We're working remotely, and they should be reviewing, and you should be getting approvals as such. We are trying to streamline and minimize, as Bernie said, what we accept and look at when we do a modification plan. And so we will put those guidance out. But if you submitted, the regions are still working and processing those accordingly. All right, that concludes all of our questions. One of the things I do want to mention is some people are asking about if you are joining them via call that you can't see the presentation, and where is it? It is on the right-hand side of this. You can download it. If you're on the phone, we will, within 2 hours after we do our presentation, we upload it into the DDA website under COVID-19, and then under there you will see it'll say deputy secretaries, and it'll say the date of the webinar. I do wanted to emphasize, based on some of the questions, when you go into the website, the information is broken down into 3 major categories: information for providers, information for families, and information for the right care support professionals. For the families, we have in there included folks for self-direction, and some of the comments you wanted to separate those out. So that's good feedback that we will take into consideration. But I wanted you to know that that's where you can find the information. That's all I have, Bernie.
All right, well, I want to thank everybody who's joined the webinar today, and be safe. Take care of yourself. Take care of the folks that you provide supports to. I know you do. But you know, we'll get through this. We'll get through it. You know, again, as soon as we know about Appendix K, we will send out an email blast. Please make sure that you have signed up through our website to receive our notifications. And everybody have a good weekend. Thank you.